So first I would go and I would check the orders before coming in the room and gather all of my supplies. So I come in the room, hi, my name is Abby and I'm going to be your nurse today. I would identify them, name and date of birth. I would explain to them that I'm doing their central line dressing change and a blood draw, and just ask them if that was okay and get their permission. So they said yes. So first I'm going to hand hygiene and put on gloves. And I'm going to go ahead and get everything opened and set up and ready. For the dressing change and for the blood draw. So I want to make sure I have saline and some new caps. So for the blood draw, I'm going to go ahead and prime my new tubing so it's already ready. So get the air out. And prime it and have that ready to go. Okay. So then I'm going to have my dressing change kit, and I'm going to go ahead and open it up. So I want to open it up away from my body. And then I'm going to go ahead and grab the mask out and have the patient put on a mask. So just take it, and I'll have them, I'd always have a mask on myself, but I would also put a mask on the patient and have them turn their head away from the procedure. So there's that. So after they have their head changed, I'm just going to go ahead with taking it off. So, oh, if there's anything running, I would stop the infusion and then I would clamp the tubes. So just going to go ahead and take it off. You're always supposed to pull or take the dressing off away from the insertion site to keep from it pulling out. And it's supposed to have a vial patch, but this one doesn't. Okay, so I'm just going to secure it. Okay. And then I'll just throw this and the vial patch away in the trash can. So after I do that, I'm just going to inspect this site, make sure it doesn't look red or swollen or infected. So, and then I'm going to take my gloves off and I'm going to start the dressing change. My gloves off, throw away, do hand hygiene. Okay, so now I'm going to pick up my sterile gloves and I'm going to put them on, only touching out 1 inch border. Without touching the inside with my other hand. Okay. And do the other one. And now the inside of this is sterile, so I can touch it and throw it away. So, first thing I want to do is I'm going to take my alcohol swabs, just open those up, take the one, throw away, and I'm just going to clean around the side. So I just go vertically this way, horizontally, and then start from the inner and go out. Throw that away. And then I'm going to take my chlorhexidine, dust that, and then I'm going to go in a circular motion 2 to 3 inches from the insertion site. So all the way around. And then I'm also going to clean the lines. Okay, so then you have to just discard that. And then you have to let this completely dry before you put your vial patch on. So once this is dried, just take a vial patch and put it around and to secure And then I can take my occlusive dressing. Just put it on there, making sure that the whole insertion site is covered. Make sure that's on good and tight. Oh, it's just not tearing good. And after that, I would take the label that's put on and put it on right here, and I would date, time, and initial the dressing change. So there's the dressing change, and then I would plug it back up to any type of infusion, and I would unclamp the lines, and then I would also change the tubings. So for the blood draw, I'm going to use this right here because it's the only one that draws blood. So for this, it doesn't need to be sterile, so I could take my gloves off, do hand hygiene, and do that. So first I would stop the infusion, and I would clamp here to do that. So first what I'm going to do is I'm going to take 10 mLs of normal saline, and clean with alcohol, take 10 mLs of saline, and I would flush it using a pulsing motion. Okay, and then I'm going to take out 10 of blood, take it off, discard. But I'm going to put it back in and pretend that. Okay. So once I discard it, I'll get me a 10 ml syringe that is empty. And I'll take it, clean it off again, and then draw back 10. And this will be the one that you save, and this will be your sample. So I'm just going to go ahead and take off the whole cap, lay it to the side, and then I already had a new cap primed and ready, so I'll just attach that, and then I would flush again using a pulsing motion. Now there's a new cap on it, do that, and then I would take a new bowel, or an antimicrobial cap, and put it on top as well. And then with the blood, I would put it into the little tubes, put it in a bowel, hazard bag, and then take it out to the lab. Thanks.